What is sciatica and how can chiropractic help? Sciatica is one of the most common low back problems that we see in clinic and around the world. So sciatica is characterized by pain or neural pain that runs down the leg. So it can run from the top of the buttock all the way down to the foot or anywhere in between, and any combination of that. So the most common causes of sciatica are a disc bulge. So that can be, for example, from the lumbar spine, the lower lumbar spine, so maybe L5, which is the last lumbar vertebra, and that can be caused either down one leg or both legs, depending on how the disc bulge sits. So you could have a posterior lateral disc bulge, which means it's just coming out on one side, or you could have a central one, and the central one would then hit both nerve roots and the patient would experience sciatic pain, which is like tingling all the way down the leg. That's a disc bulge. You could have facet joint pain. So the joints that make up the lumbar spine are called the facet joints, and they can get irritated as well. And the patient would typically have pain that runs down to their knee, usually stops around their knee, but it can sometimes overflow a little bit lower. You can also have a thing called piriformis syndrome. So the piriformis is a big muscle that sits in the low part of the buttock, and it will actually compress the sciatic nerve, and that is called piriformis syndrome. All of these types of causes of sciatica will be treated differently. So we would look at reducing the inflammation in and around the disc for the disc one. We would reduce the inflammation around the facet joint for the facet joint problem, and we would look at restoring the function of the piriformis muscle for the piriformis one. So we would use a combination, for example, of needling, we would use some rehabilitation exercises, we would gently mobilize around the spine, we could use some taping methods, whether it be kinesio taping or rigid taping, and when patients are in quite a bit of pain, we can also use a pain-free laser called a cold laser therapy. And sometimes we use a combination of all those to help restore function with sciatica. With the different causes of sciatica, we will find that there's different healing times with that, or treatment times. So that can range, sometimes it can be really fast. You could have an irritation that's gone within a week. You could have an irritation that sometimes takes 6 to 8 weeks to go away. But we want to make sure that that irritation to the nerve and the reason that nerve is being irritated is taken away, or that function is restored.